Hello everyone. Thank you for coming to my presentation. It's entitled Delegation in Nursing, What I Need to Know. My name is Darina Perkins. Delegation is something that you will do often in nursing. It's something we practice literally every day. Ultimately, we want to ensure that we're doing everything we can to provide safe, competent, high-quality care to our patients. It requires collaboration, clear, and concise communication. Why is delegation so important? Listen, none of us can do it alone. It's really going to take a village to accomplish our goals with our patient. We must recognize our limitations and utilize our support systems to care for those patients. So eliminate your stress and elicit the help of your team. Other reasons why it's important to practice delegation is because it really shows your teammates that you can trust them. You show your teammates that you're confident in their abilities, and ultimately, it has the potential to improve team member performance. As a nurse, who can I delegate to? Listen, you can delegate to other registered nurses, you can delegate to LPNs, unlicensed nursing personnel. That's going to include your nursing assistants and your patient care techs and medical assistants. It's important to understand the 5 rights of delegation because this is going to lead and guide you as to what's appropriate to delegate to someone. First, you want to make sure it's the right person. Does this person that I'm delegating to have the appropriate knowledge, skills, and training to complete this task? Next is the right task. Is there special training required for this person to complete this task? For instance, in some hospitals, CNAs are able to insert Foley catheters under sterile technique. In other hospitals, that's outside of their scope of practice. So just make sure that you stop and think, is this the right task? The next right is the right circumstance. So I want to make sure that I'm delegating in the right circumstance. Let's say I had a patient with a blood pressure of 198/86. The patient is complaining of shortness of breath. He might be complaining of dizziness and lightheadedness. I would not send my care partner in to check their blood pressure. I would actually go in, assess the patient, check their blood pressure, administer a PRN, make sure the doctor is notified, go back in, reassess the patient, and restructure his plan of care based on my assessment. Next are right directions. We want to be sure that we communicate clearly and concisely. I would encourage you to give your instruction and ask them to repeat back to you. That way you are sure that they have gained clarity on what you asked them to do. Lastly, it's the right evaluation. We want to make sure that we go back and reassess our patients, and again, we can manipulate their plan of care based on what we have assessed. Let's talk about the essential components of delegation. Number 1, to reiterate, the RN retains primary responsibility for the care of the patient. You can delegate the task, but it is your job to make sure that the task was properly completed and the patient was reassessed. Authority. Ask yourself, does this delegatee possess the necessary education and skills to complete the task? Make sure that any assigned tasks are within the delegatee's scope of practice. And lastly, responsibility. Communicate clearly and concisely obtain verbal feedback regarding their understanding, and the individual who has received the instruction is expected to complete all of the assigned tasks. You may ask, what are some ways that I can determine what is appropriate for me to delegate? Start by reviewing your hospital's policy and procedures. Next, if you're still not sure, we have our nurse leaders for a reason. Utilize them. Next, you can utilize a delegation flowchart to help you make a decision as to whether or not you should delegate the task. Another thing you can do is check the Nurse Practice Act of your state. This is a great resource for helping you determine what is allowed to be delegated in your state. Lastly, you can visit the Joint Statement on Delegation, which has been published by the American Nurses Association and the National Council of State Boards of Nursing. Thank you for coming to my presentation. You have a great night. Hello everyone, welcome to my presentation on delegation entitled Delegation in Nursing, What Do I Need to Know? Delegation is something that we as nurses are going to do all the time. Why? Because we want to provide safe, competent, high quality care to our patients, and it really requires collaboration, clear and concise communication. So what is delegation, you ask? Delegation is the process in which one individual performs the act of assigning or directing someone else to complete a task. Remember, the delegator always retains responsibility for any assigned task. Why is it important to delegate tasks? Taking care of our patients is really a collaborative effort. No one person can do it alone. It really takes a village to accomplish this goal. We must recognize our limitations and utilize our support systems to care for our patients. So, decrease some of your stress and elicit the help of your team. Other reasons why delegation is important is because it shows your teammates that you have trust in them. It shows them that you're confident in their individual abilities, and ultimately, it has the potential to improve team member performance. As a charge nurse, who can I delegate tasks to? You can delegate tasks to other registered nurses, LPNs, unlicensed nursing personnel, that would include your nursing assistants and patient care techs, and medical assistants. It's important to understand the 5 rights of delegation because these rights are going to help you figure out if you can delegate this task to the person you want to delegate it to your delegatee. So, the first right is right person. Does the person that you want to delegate this task to have the appropriate knowledge base and competence for safely completing this task? Have they been trained to do this? Right task. Does this task require special training or knowledge to be able to perform it? For instance, at some hospitals, certified nursing assistants are trained to be able to insert Foley catheters under sterile technique. At other hospitals, they're not. It's strictly a nurse task. So make sure you know if the task is appropriate for your delegatee. Right circumstance. In some instances, you just shouldn't delegate the task. For instance, I have a patient whose blood pressure is super high. Let's say it's 190/86. So I don't think it's appropriate to Ask a certified nursing assistant to go retake their blood pressure. Why? Because I need to go in and assess that patient, make sure they're not symptomatic, give them a blood pressure medication, make sure I follow up to see if their blood pressure came down. It's too critical of a situation to delegate that task to a CNA. However, regular patients who are mostly stable, yes, you can get that blood pressure and report the results back to me. Next is write directions. When you're communicating, we know communication is so important. Be clear, be concise. Make sure step by step, leave nothing to the imagination. Make sure they understand your instructions clearly. Hey, Elizabeth, can you go and take a blood pressure in room 405 and report it back to me within 10 minutes? And write evaluation. Again, it is our responsibility to make sure the needs of the patient are met. So you want to go in and reevaluate, assess your patient, and see if the plan of care needs to change. Essential components of delegation. So some of these things we touched on earlier in the presentation, but we're going to go over them one more time. So again, I can't reiterate this enough. Accountability, it's the primary nurse's responsibility to make sure that everything is completed for the patient as far as care is concerned. You can delegate a task, but it's your responsibility to follow up to see if the task was completed, see what the results were, and reassess your patient. Again, when you are delegating your task, think first, stop and think. Is this person qualified to complete this task? Have they had the education and the training to complete this task? You want to make sure that any assigned tasks are within your delegatee's scope of practice. Lastly, responsibility. Communicate your instructions clearly. Obtain verbal feedback regarding understanding. Assign the task and have them repeat back to you what you want to do. That way you know that they're clear about what you need to have happen. Now, how can I determine what is appropriate to delegate? Sometimes we're just stuck. I would say when in doubt, go and do it yourself. But there are some other ways to figure this out. First, start by reviewing your hospital's policies and procedures. That's always a great place to start. Next, we got our charge nurses and our nurse leaders for a reason. They've been here for a long time. They know it all. Most of it. They know a lot. So go to your nurse leader and ask them, hey, do you think I can assign this task to this person? You can utilize a delegation flow chart. Another thing you can do is check your Nurse Practice Act for your specific state. That'll definitely give you some guidelines on what you can delegate specific to your state. Lastly, review the joint statement on delegation, and it's published by the American Nurses Association and the National Council of State Boards of Nursing. I thank you for coming to my presentation, and I hope you guys have a great night.